Hello everyone and welcome. Morning cough is a common symptom that can be uncomfortable and concerning for many people. It can be triggered by a variety of factors, ranging from seasonal allergies to more serious chronic conditions such as asthma or chronic obstructive pulmonary disease, COPD. Understanding the various causes of this symptom is crucial for obtaining an accurate diagnosis and an effective treatment plan. In this video, we'll dive into the main causes of morning cough, covering everything from common respiratory issues such as colds and allergies to more complex issues like acid reflux or sleep apnea. Additionally, we'll offer practical tips and advice on how to relieve morning cough and improve the quality of sleep in daily life. If you're experiencing morning cough and looking for reliable and useful information on how to deal with this symptom, this video is for you. Keep watching for valuable insights and learn effective strategies to manage and reduce the incidence of this health problem that affects so many people worldwide. One of the most frequent causes of morning cough is postnasal drip, a phenomenon where excess mucus from the nasal passages drips down the throat, triggering the cough. This problem can arise for a variety of reasons, including seasonal allergies, sinus infections, or even climate changes. Typical symptoms include sore throat, nasal congestion, and the persistent sensation of needing to clear the throat. Treatment for postnasal drip may involve various approaches. This can include the use of nasal sprays to reduce inflammation and congestion, antihistamines to control allergic reactions, decongestants to relieve nasal congestion, and managing underlying allergies or sinusitis. Additionally, using a nighttime humidifier can help keep the airways moist overnight, easing throat irritation and cough. In cases of persistent morning cough and severe symptoms, it is important to seek guidance from an otolaryngology or allergy specialist. They can perform more detailed evaluations and recommend more specific treatments, such as nasal irrigation, prescribed medications, or allergy tests to identify and manage underlying triggers. Asthma is another condition that can trigger morning cough due to inflammation and narrowing of the airways, often accompanied by wheezing, shortness of breath, and chest tightness. These symptoms can be especially pronounced in the morning due to increased mucus production during sleep. Managing asthma typically involves the use of inhalers containing bronchodilators to open the airways and corticosteroids to reduce inflammation. It is essential to follow a personalized treatment plan developed by a doctor, which may include daily control medications and quick relief medications as needed. Additionally, regular follow-up with an allergy and lung specialist is important to monitor the condition and adjust treatment as necessary. For individuals with asthma, it is crucial to maintain an allergen-free environment, such as dust, mold, and pet dander, and avoid exposure to known triggers, such as cigarette smoke and air pollutants. Taking measures to reduce exposure to these triggers can help minimize asthma symptoms, including morning cough, and improve quality of life. Colds or flu can also be responsible for morning cough, usually due to congestion and postnasal drip as the body fights off the viral infection. During these conditions, the excess mucus produced in the airways can drip down the throat overnight, triggering the cough in the morning. Treatment for colds and flu generally focuses on symptom relief to facilitate recovery. This can include the use of cough medicines to help reduce throat irritation and suppress the cough, decongestants to relieve nasal congestion, and pain relievers to reduce fever and body aches. Additionally, adequate rest and hydration are fundamental to promote recovery and help the immune system fight off the infection. Although colds and flu are generally self-limiting and tend to improve within a few days with proper care, it is important to consult a doctor if symptoms persist or worsen, especially if there is difficulty breathing, high fever, or other signs of complications. The doctor may recommend additional treatments, such as antivirals if necessary, and provide guidance on when to seek urgent medical care. Dry mouth, often caused by dehydration, certain medications, or habits such as breathing through the mouth during sleep, can contribute to morning cough. When the mouth is dry, the mucus that normally protects the throat can become thicker and stickier, triggering the need to cough to try to remove the sensation of irritation. To alleviate morning cough caused by dry mouth, it is important to increase fluid intake throughout the day to stay well hydrated. The use of saliva substitutes, such as lozenges or specific gels, can help keep the mouth moist and relieve throat irritation. Additionally, mouthwashes formulated to alleviate dry mouth can be useful for stimulating saliva production. During the night, using a humidifier in the bedroom can help increase air humidity and reduce the sensation of dryness in the mouth and throat. Breathing through the nose whenever possible, especially when sleeping, can also help minimize saliva evaporation and keep the mucous membranes of the respiratory tract more moist. If morning cough persists despite these measures, it is important to consult a doctor for evaluation and appropriate treatment. They can investigate other possible underlying causes and recommend the most suitable treatment to alleviate symptoms. Gastroesophageal reflux disease, GERD, where stomach acid returns to the esophagus, is another common cause of morning cough. When stomach acid enters the esophagus, it can irritate the throat and trigger coughing, along with symptoms such as heartburn, chest pain, and difficulty swallowing. Treatment for GERD typically involves a combination of lifestyle changes and medications. This can include avoiding foods and drinks that trigger reflux, such as fatty, spicy foods, alcohol, and caffeine, as well as avoiding heavy meals before bedtime. Maintaining a healthy weight, avoiding smoking, and elevating the head of the bed during sleep can also help reduce symptoms. In addition to lifestyle changes, medications may be prescribed to reduce stomach acid production and relieve symptoms. This can include antacids to neutralize the acid, acid-reducing medications such as proton pump inhibitors, PPIs, or medications that coat the esophagus and help protect it from stomach acid. If GERD symptoms persist despite lifestyle changes and over-the-counter medications, it is important to consult a doctor for further evaluation and treatment. They can perform additional tests, such as endoscopy or esophageal pH monitoring, to assess the severity of reflux and determine the best course of treatment to alleviate symptoms and prevent complications. Smoking is a significant cause of chronic morning cough due to irritation and damage to the airways and lungs. Continuous exposure to tobacco can lead to mucus buildup in the airways, resulting in persistent coughing, especially in the morning. The most effective solution for morning cough related to smoking is to quit smoking. Quitting smoking can not only help reduce or eliminate morning cough, but also bring a host of other health benefits, including reducing the risk of chronic lung diseases, such as chronic obstructive pulmonary disease, COPD, and lung cancer. For those wishing to quit smoking, various support options are available. This can include nicotine replacement therapies, such as patches, chewing gum, or nasal sprays, which help reduce nicotine withdrawal symptoms. Additionally, prescription medications, such as bupropion and varenicline, can be helpful in reducing cravings for smoking and withdrawal symptoms. Besides medical support, participating in support groups or smoking cessation programs can also be beneficial. These groups offer emotional support, coping strategies, and practical guidance to help individuals overcome the challenges associated with quitting smoking. Quitting smoking can be challenging, but with adequate support and determination, it is possible to achieve and maintain a tobacco-free lifestyle, significantly improving respiratory health and reducing the incidence of morning cough and other health problems related to smoking. Allergies can trigger morning cough through the body's reaction to allergens, leading to the release of histamine. Treatments include antihistamines, decongestants, and nasal corticosteroids. COPD, a group of lung diseases, causes chronic morning cough, with treatments focused on relieving symptoms and slowing the progression of the disease. Bronchitis, inflammation of the bronchi, and environmental irritants, such as pollution and dust, are also common causes, with treatments varying depending on the condition. In addition to the previously mentioned causes, such as postnasal drip, asthma, gastroesophageal reflux, dry mouth, and smoking, there are other conditions and factors that can contribute to morning cough. Respiratory infections, such as colds, flu, bronchitis, and pneumonia, are common examples that can trigger morning cough due to irritation of the airways and increased mucus production overnight. Respiratory infections can cause inflammation in the upper and lower airways, leading to symptoms such as cough, nasal congestion, sore throat, and fever. During sleep, the buildup of mucus in the airways can become more evident, resulting in morning cough when the individual wakes up in the morning. Treatment for respiratory infections depends on the type and severity of the infection. Generally, it includes rest, hydration, medications to relieve symptoms, such as pain relievers and antipyretics for fever, and, in some cases, antibiotics if there is a bacterial infection. It is important to consult a doctor if the cough persists for more than a few weeks or is associated with other severe symptoms, such as difficulty breathing, intense chest pain, or high fever. The doctor can assess the underlying cause of morning cough and recommend the most appropriate treatment to alleviate symptoms and promote recovery. Please remember that this video is for informational purposes only and does not substitute for medical consultation. If you have persistent morning cough, especially accompanied by other symptoms, it is important to seek medical evaluation. I hope you enjoyed this video. Please leave a like, subscribe to the channel, and see you in the next video.